Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
This is Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. In this 2-episode series, Dr. Erica Ramey and I are going to be exploring how different personality traits, characteristics, and personal styles can potentially influence your fit within various nursing specialties. Dr. Ramey, do you want to share a little about yourself before we get started?
Sure, I'd love to. I have been in the mental health nursing field for about 17 years. I'm a psychiatric mental health nurse practitioner in a private practice and an associate professor of nursing. So I teach psych nurse practitioners as well. I love nursing. My experience is in the hospital setting, and then now more recently in the outpatient setting. So this is a fun topic. I'm excited to talk about this with you today.
For sure. Thank you for joining us for this fun topic. I will say, though, between these 2 episodes, we're going to discuss some core personality traits and how those traits might align with some certain areas of nursing, be it the compassionate caregiver to the analytic problem solver. We're just going to really try to uncover some of those unique traits that are valuable to the healthcare setting. And then hopefully in episode 2, we'll get to take it a step further by kind of matching some of these traits to different nursing specialties and really just offer some self-awareness that can kind of guide you in finding your specialty and kind of guide you in finding your fit wherever your personality will enhance your career satisfaction and performance. But Erica, before we dive into this topic, I really thought we should give a quick disclaimer. So while certain traits, we know they are going to lend themselves better to specific specialties, this absolutely does not mean that someone cannot be successful in any area of nursing. Every nurse is going to bring a unique blend of skills and perspectives that can be really valuable in any specialty. Is there anything you want to add to our disclaimer?
I'm so glad you said that. So some of this that we'll discuss is a little bit anecdotal or soft psychology, if you will, soft science. And I agree. I would add to that if you find an area of nursing that is a good fit for your personality type and your preferences, you may thrive better than if you're trying to fit yourself into an area that maybe isn't as much of a natural fit. But that said, especially with our current nursing shortage, you can work where you want to work, right? And there's certainly, we'll talk more later, but there's certainly things that you can do to grow skills or traits that you already have, if that's what you desire to do. So yes, thank you for saying that.
Absolutely. I just thought it was really important we threw that out there. And okay, let's have some fun talking about some personality traits. So I want to start with, what are some of those core personality traits that can help nurses succeed across different specialty areas?
Right. So there are some traits that are beneficial no matter what area of nursing you find yourself in. And any role that is direct care or patient facing, I would start with empathy and compassion. Those traits really go a long way when we're working directly with patients. So those are essential. I'd absolutely say being able to put yourself in the patient's shoes, so to speak. Remind yourself that even though this is work and you're used to it and you know what to expect and you're kind of clocking in, to the person in the bed, this is often life-changing or certainly not what they would choose to be doing. And they don't have as much control or say over what's going on in their life right now. There's a lot of anxiety that they could be experiencing. So even though we're clocking in and it's business as usual, the ability to take a step back and empathize with your patient and remind yourself that this is quite a traumatic experience for them, no matter the area of nursing that you're in. I think that goes a long way with our patients. So I would start with that. I would start with empathy and compassion. And those are oftentimes what we think of. I think when we think of a nurse, we think of, oh, well, they're compassionate. They just really want to help people. And that's great. But the next step I would say would be a lot of flexibility and adaptability, because we know
Yes.
things go sideways very
Yes.
quickly, no matter what
Mhm.
area of nursing you're in. And so we really are kind of masters of the art of the workaround. So,
Yes.
I mean, we know what that's like, right?
For sure. Thinking on your feet, trying to solve
Yes.
problems, so being a problem solver. But I was also thinking about the ability to compartmentalize. But I also see that as a double-edged sword too. I feel like
Right.
when we clock in, we have to be able to kind of set aside what's going on in our life in order to focus on and be present for our patients. But at the same time, I see that also feeding into some of that burnout.
Right,
So,
right. And it's not entirely possible. So the expression to kind of, leave that at home or leave that at the
mhm,
door, just like when we leave work, we can't necessarily just leave our work experience at the door when we walk in our home. We don't leave
right.
our home and who we are and what we're experiencing at the door when we clock in for work. Now, we do want to try to keep it from impairing what we're doing. And, if a
Absolutely.
nurse is finding that to be difficult, then self-care, maybe therapy, there's some work that will have to happen kind of off the clock to help with that. But we are who we are because of what we experience. So a lot of that can be very positive in your nursing role. In fact, we were just talking about empathy and compassion. Experiences that are similar are very helpful for us to empathize with our patients. And if, especially in, well, we'll go into specialties later, but I know in mental health, being able to empathize with people who are experiencing a struggle is sometimes easier for people who've experienced a similar struggle. So it's a balance, kind of as you alluded to. We do want to make sure that it's not affecting our professionalism or our ability to provide high quality care. But we're not robots. We don't want to check who we are
Right.
and our experiences at the door. We just want to make sure that there's a good balance between uh, bringing it in and being true to who we are, but then also making sure that it's not negatively impacting the
Mhm.
care that we provide. So it's a little bit of a dance. Absolutely.
Absolutely. And then also not, yes, we have to be empathetic, kind of look at it from their perspective and their shoes, but we also need to not carry their load, so to say.
Right. Right. Yeah, ooh, you're nodding like, okay, did just expand on that a little bit.
Yeah.
Yeah, that's really hard to do, and that's part of why some specialty areas are better suited for some people than others. If if you're a very empathetic person and you just kind of you have a bleeding heart, so to speak, it's going
Mhm.
to be more difficult for you to really have that balance there and to compartmentalize, as we mentioned. And you might notice that you bring home work more than the average nurse, or that it's really starting to affect how you can connect with your family or your
Mhm.
friends outside of work. And I would say we really have to be careful of that, because that does lead to burnout and it leads to emotional exhaustion. And so
Mhm.
sometimes that's a good sign that maybe we need to consider a different area of nursing. But then other times we can just take that and we can work in therapy. We can work on, being self-aware, recognizing
Mhm.
what we're noticing, and then kind of setting boundaries around some of the aspects of our role. But that is challenging. That is one of those things that really is easier said than done, but it's not sustainable long term. So
Absolutely.
we want to be mindful of that and try to catch that if we notice that happening in ourselves.
So then that leads into how important are the traits like resilience, and you mentioned adaptability, but
Yes.
also like emotional intelligence for nurses.
Yes. So emotional intelligence that's probably sort of the catch all term there. So your ability to kind of read the situation, understand the feelings and motivations of the people around you, that will make you more successful no matter what area of nursing or really what area of anything you're
Right.
working in. So that is very important. And that's a skill that can be developed. So if there's a lot of online emotional
Mhm.
intelligence kind of questionnaires you can do, and if you find that that's a skill area that you're lacking in, there are many resources for helping you develop emotional intelligence. So I would want to encourage anyone who wants to grow in that area to seek out the resources for that. It will benefit you in every area of life to be more emotionally intelligent. So I'm glad you brought that up. But also, we know that, we come in, we clock in, and then we immediately find out we're out of this supply, or we're one or two nurses short of what we were expecting to optimally take care of our patients, or we had to shut down these rooms because something happened. And so the ability to kind of accept that and adapt to that is very important. But Candace, I want to mention, it doesn't mean we just, as a profession, are okay with being run over, right? It doesn't mean that
Right.
we don't demand better resources and better staffing.
Absolutely.
We do,
Yes.
because we do, but we know that in the moment, the top priority is going to be providing the best care for our patients despite that. And then, on our off time, we're going to be advocating for change and safe, high
Yes.
quality care.
Yes. And
Yes, very much
policy,
so.
advocating for policies,
Yes.
advocating for, not that long ago, I was able to speak with, it was a lieutenant governor, currently sitting, who is a nurse. I think we've only had 2 lieutenant governors who have been nurses, but being able to learn how to use our voice and the knowledge, because we don't realize how much knowledge that you have as a nurse.
Absolutely.
To really start pushing change that leads to better staffing, better community for your home, but also within your profession and where you work. Like, our voices, there are so many of us. If we would just learn how to use our voices, which is totally off topic, but
important. So,
yes.
Because while I'm telling everybody, be flexible and be adaptable and try to work well with others, it doesn't mean that we aren't doing what we need to do to make sure this isn't happening every time we clock in. But we do have to be present for our patients for that particular shift. So yes, that's a little sidebar there, but very important.
Yes, for sure. Well, what role does creativity and critical thinking abilities play within various nursing roles?
So the creativity is part of that helpful component for problem solving when you are taking care of patients. When you're having to figure out how to do without something that you need to handle something, or when you're having to creatively problem solve an issue with a colleague or a patient.
Yes.
I could think of a lot of examples, but they're probably in poor taste for this particular podcast. But we're doing the best we can, and
with what we have,
and that does require creativity and kind of on the spot thinking. And critical thinking, with my students, I really like to stress that in addition to the emotional intelligence, critical thinking is one of the most important skills that I would like for them to develop for their role, because you will be making very quick, on the spot decisions that have the potential to significantly change and impact an outcome for a patient.
Absolutely.
So being able to just kind of take a step back very quickly, take a snapshot of the situation, and then decide what the next best step is so very important. There's some conflicting research on if you can improve critical thinking. I lean in the camp that says, yes, you can, that it is a practice, exercised approach to thinking.
Learned skill.
Absolutely. Absolutely. A learned skill. So if it is not in your skill set, I would encourage you to, again, seek resources and some training in that area, because it's very important. Your patient's outcomes often depend on how quickly you're making an assessment and thinking, and then getting in touch with the provider and either requesting an order change, or just letting them know, hey, I've got some concerns here. This doesn't look right or feel right or seem right. It can be life-changing for the person that you're taking care of.
Yes. And I'll say for being an educator myself, is I feel like as we are in our roles as nurses, we gain more ability within our clinical reasoning and our critical thinking skills, so taking the time to learn from yourself It doesn't matter if you've been in a role for 5 years, 3 years, or 20 years. There's always something that you can learn from situations that will help to continue to grow that skill of clinical reasoning, critical thinking, however we want to call it these days.
Yes, yes.
So they all really play in together.
And all experience can be beneficial for developing the critical thinking skills. So, not just nursing. So, sometimes I'm working with a new grad, but they've been in the workforce in some capacity for 20 plus years. So I like to remind them that you're not just bringing in critical thinking from nursing you're kind of a novice with, you're bringing in critical thinking from what you used to do as well. So the skill's already there. We just need to adapt it to this setting where you're less confident because you have a little less experience, but you're actually very skilled at thinking the way that you need to think. We just need to help you remember you already have the skill. We're translating it to healthcare. And sometimes that's helpful for people because, especially for a new grad, you feel sometimes a little bit out of your element and maybe overwhelmed and like, did I learn everything I was supposed to learn in nursing school? And should I be doing this? They're just going to let me take care of people. So remembering you have, in many cases, those skills already. We're just helping you apply them to a new setting, to a new population.
Absolutely. That's so good too. Because I always use the driving. Like when you're driving, you're actually critically thinking, like, what is that guy going to do? What's that guy? Yeah, hopefully you're defensive driving, like what's that person going to do in front of me? And what am I going to do when they do that? Like maybe you don't even realize that you're doing that because for a lot of us, we've been driving for so long now that it's just kind of natural. So it just kind of flows.
Flowing from muscle memory, yeah?
Absolutely.
But not for a 16-year-old.
No. When you were talking about creativity, though, I was thinking that it connects so well to flexibility. Those two go so well together because you are looking at, what do I have that I can now achieve, whatever this task is that I'm trying to achieve. And then it plays into that flexibility of using the tools that we have. So when you were really hitting on creativity, my mind immediately went to, you probably have to have some flexibility in order to use creativity.
Absolutely. Well, and creativity requires some flexibility because if you're not flexible, you're not seeing outside of the box. You're not being very creative. It's just kind of a rigid mindset. No, this is the way we've always done it. This is how we have to do it. Instead of thinking, well, we can't do it that way because we don't have what we need to do it that way. So let's be flexible. Let's think outside the box. Let's be creative. So I think the two sort of require each other there. If you're not flexible, you're not likely to be very creative in your thinking at all.
Absolutely.
So that's a good point.
It's looking at, I know just the other day I was talking to someone and they were like, how can we go from yes, but to yes, and? Creativity and flexibility.
Exactly. Well, and because your goal there is different. It's a totally different mindset, right? So instead of looking at all the ways this could go wrong, we have to think of all the ways this could go right. What might work here?
Absolutely.
It's a shift in your framework there and how you're approaching things. Easier said than done. Yeah.
Yes, it is. The learned skill. That's a learned skill too, I think. So how can strong communication and interpersonal skills really benefit nurses in any specialty?
Well, aside from potentially saving someone's life, we're going to gloss over that, right? But I think every area of nursing benefits from clear, strong communication skills, whether you're at the bedside or management. Let's just say administration, IT, any area of nursing research. The clearer we communicate, the less conflict we'll have in our work environment, the less room for misunderstandings, discrepancies, the less wasted time in doing what is best for the patient or the unit or the department or the student, as it may be. There's a lot of resources for improving how we approach conflict and improving how we communicate with other people. There is sometimes a tendency to soften or kind of beat around the bush sometimes in nursing care environments because we don't want to hurt people's feelings or we don't want to create conflict. And that's okay as long as we can still have timely, clear, direct communication. You know, a code setting, for example, is not a good time to be like, is that okay? Does that make sense? Am I saying that the right way? Of course, we would never do that. We would give very clear, very
Right.
firm, you can't misunderstand me kind of directions in a code because it's essential and someone's life is depending on it. So if we
Right.
could take that same communication and use that with our coworkers where we're being clear and we're direct and we're closing the loop and making sure everybody understands each other, that results in better, quicker, more efficient outcomes in every other setting as well. We just tend to, especially, I'm from the South, we tend to soften and kind of, make it flowery. And then sometimes our meaning gets lost in that.
And the
And then
flowers.
sometimes, yeah, in the flower, it's just in the garden somewhere out there. And sometimes that works against us as a profession as well, because sometimes it leads us to be viewed as maybe less intelligent or maybe less suited for leadership, which of course is absolutely not the case. But we do sometimes struggle as a profession with being as direct at the table as compared to some of our other healthcare colleagues.
Well, but then you have the opposite of that, where it's if I come in and I'm very direct, I'm seen as being hard to work with,
Sure.
or, so how do you kind of work around? Is there a middle ground?
Sure. Yeah. You keep it about the facts, right? So we can't help how we're perceived by everyone all the time, but we can make sure that the language we're choosing isn't personal. So we're never coming after another person. Well, she's this or she's that. We're coming in and saying, what I'm noticing is this is happening and then XYZ, these things seem to happen. So we're keeping it about the situation, we're keeping it about the concern, and we're not making it about another person. And that can be very helpful because at the end of the day, when you've kind of gotten down to the nuts and bolts of the situation, you have facts that you're looking at and you're not looking at people as the problem. Same thing when we're doing quality improvement in healthcare, right? So we could say, well, the nurse made a medication error. It's really, this is an issue with that nurse. Or we could look at it as, well, what was the system in place that contributed to a person making an error? Because people make errors.
Absolutely.
So instead of focusing on disciplining the person who made the error, what can we do to keep the next nurse from being in a similar situation? Where did we go wrong in the system? So that can be helpful a little bit. You're never going to be able to word something just such that no one is upset by it. That's just not possible because we're all bringing in our experiences and our backgrounds and different things offend us. And we can't always account for that for everyone, but we can try to make it about the situation and factual so that it's clear we have the same goal here. We're trying to all reach the same goal. And it's not about what you did or what I did. It's about how can we make this situation and this system better for our patients.
That is so good. I love that you shared that because, one of the other things that I was looking at with interpersonal skills is that a lot of times we don't listen well. We listen to respond. We listen to, in our head, I'm thinking like, ooh, what's Erica talking about? Now, what am I going to say next?
Right.
Rather than, focusing on what the person is telling us so that we understand what they're saying. So I think that's also a really good interpersonal skill that I know I have to work on that a lot. I have to be like mindful to be like, I need to listen. That way I'm not perceiving something that isn't there or perceiving something that is incorrect and miscommunicating with my patient or my student or the physician.
Yeah, that's a good point. And this may be my mental health background here, so I won't make any assumptions, but generally people can tell when you're listening because you want to hear them and you want to understand what they're talking about versus when you're listening and just preparing for what you can say next. And I had this conversation with my son. I have a teenager yesterday when he was talking with his girlfriend and her mom, I'm like, shh, little pat on the arm. Just listen to what she's trying to tell you. Give her a he was just excited. But we do that a lot. We kind of assume we know what they're about to say, and maybe we're right, or maybe we're way off off mark, but either way, we're not listening if we're thinking about what we're saying next. But again, that's a skill, a teachable skill that can be improved. We can all improve our listening skills. It sounds cheesy saying it out loud, but we really can be better
Yes.
listeners.
Mm-hmm.
Yes. That's a
Yes.
good point.
And I think that that's also self-reflection for, I have to reflect and be like, am I doing this? And it's funny you mentioned that you were talking to your teenage son because I have a teenage daughter, and I've been teaching her the same thing. Like, you need to hear what we're saying.
Right.
Listen, listen. There's different versions of listen. All right. So moving back to compassion and empathy, are these innate or are these learned? Can they be grown and developed?
That is also a controversial question because you'll find some literature that suggests that in some ways these are innate skills, but I have seen people who did not feel that they were naturally empathetic be able to develop empathy and to practice at least expressing empathy, and then sometimes the feelings come later. So sometimes we learn the action, practice the action, and then it comes later. And then, of course, there are some mental health concerns that make empathy for others or compassion for others either more difficult or in some cases absent. And in those cases, especially, working on practicing the action can be especially helpful. And hopefully the feeling comes later. Sometimes it doesn't, but it's still beneficial socially to practice behaving as though you have compassion or empathy. That's an extreme case. Most of us certainly have the ability for empathy and the ability for compassion. I do think it does come more naturally for some people than others, but in most of us, that can be nurtured and developed and practiced, even if it's maybe not a strong area for us.
That's good to know.
Yes.
So looking at personality factors, what personality factors might make someone better suited for a fast-paced, high acuity area versus like a primary care area?
Good question. So if you want to work in one of those fast-paced, high acuity areas, you need to really like a little bit of stress. So maybe be someone who thrives best when you're very active. So you've got a good level of energy. You like being challenged. You like making those quick decisions, as we were discussing earlier. And then you have a pretty good stress tolerance. So your ability to kind of manage being, slightly elevated with your stress for an extended period of time, that might be a good fit for you. If you get bored easily, for example.
Well, usually long periods of time, I think, is the key there. Can you handle stress for a 12-hour shift?
Right.
Yeah. And then with primary care.
Yes. So with primary care, that's a little more, a little bit slower pace, but you do need to have really great attention to detail. So someone who's a little more detail oriented, who maybe likes building longer term relationships with your patients, because you'll be seeing them again and again and again. And those relationships actually help impact your patient's care over time because they learn you and they build rapport and then they trust you. So you have an opportunity to influence their daily health care and health promotion activities. So that's really great for people who like to build those relationships and pay attention to what's going on with people and are more detail oriented.
Absolutely. Those are good things to think about. So what about detail oriented versus, seeing that big picture?
So there are times when detail is really important. So big picture is really good for visioning and planning, and I would say leadership and administration and quality improvement in the healthcare setting. It's very important to see big picture. But then also in day-to-day point of care, it's really great when you are detail oriented and you're making sure we really did get them turned every 2 hours, and you're making sure that wound care really was done exactly how it needed to be done. From a legality standpoint, it's great if you're detail oriented in your documentation. We're making sure we're documenting what happened and we're documenting it well. So we need both. We do. We need both. But depending on the particular task or goal, one might be more important than the other. But it's most important that we have both on every healthcare team. There's a place for everyone.
Yes, there is. Our profession is so big and we have so many different things that you can do and places you can work, things I didn't even know we had that I'm just learning about here and there. So there's definitely a place for everybody and every personality within our profession. But we've come to the end of our time for episode 1. So
that's quick.
I know it went by so fast, so fast. Hopefully to our listeners, if you are new to the nursing workforce and you're just kind of trying to find a place where you fit in, or maybe you're an experienced nurse who's deciding if you want to try something new, I hope that this discussion on core personality traits has kind of given you some food for thought and a deeper understanding of how your unique characteristics can shine in the world of nursing. So overall, this is all about self-awareness and finding a specialty where you can thrive. But again, I do want to stress that it's important to keep in mind that nursing is multifaceted and it's personal. And you have a unique blend of skills and traits that really can be an asset into any area that you choose to go into. So join Erica and I for episode 2, where we're going to try to connect some dots between personalities and specific nursing specialties.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.